Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha. Thank you so much for joining us here on this Wednesday for Spotlight Hawaii. I'm Yanji Denise, joined by Ryan Kalei Suji. And Ryan, today we have a guest who always gets a lot of comments and a lot of questions.
That's right. This morning we head on over to the Hawaii State Capitol. Joining us this morning is Lieutenant Governor Josh Green. Good morning, Dr. Green. Thanks so much for joining us. Let's start off with what we're seeing right now. 139 cases reported today. No new deaths related to COVID-19. Talk about where we're at right now as a state and what you're seeing overall.
Well, thank you for having me again. We're doing really well. We now have the lowest rate of COVID in the country. Our COVID cases and hospitalizations and active cases are dropping by 50% every 2 weeks. So we're in a much better place than we were even on October 6th or on September 22nd. So to give you some perspective, 4 weeks ago, we had a positivity rate of 5.32%. 2 weeks ago, it was 3.32%. And today it's 1.7% positivity. Our hospital numbers dropped from 4 weeks ago from 282. Remember, they peaked at 448. It's really high back on September 3rd. They dropped then to 150 2 weeks ago. And then finally today down to 79, our lowest since basically mid-July. And fortunately, our fatalities have begun to drop off significantly. We're having about 100 fatalities every 2 weeks or so, and that's dropped closer to 55. So everything is going in the right direction right now because people have been so committed to getting the vaccination and to getting safe.
And a key sign that things are improving was the governor's announcement yesterday that he is rolling out the welcome mat for visitors. What can you tell us about what went into that decision, and what's your message to people who are planning to come to the islands?
Well, the governor was waiting till things were safer at the hospital level. Like I said earlier, our system almost crashed when we, in September, early September, had that huge surge of cases of the Delta variant and people in the hospital. And that was very worrisome. We had to bring in 650 plus nurses and critical care teams to really take care of people. Since then, the numbers have been dropping, and the Gov tracked the numbers very carefully with our team to make sure that we had the capacity to care for everyone. So the key metrics were and are how many people are in the hospital, how many people are in the intensive care unit. And that number is down to 22 people with COVID in the ICU, down from well over 100. And also not just the cases and the hospitalizations, but where we were on a day-to-day basis. Our positivity rate was well over 7%, which was a lot of cases and a lot of spread. Now that it's way down in kind of the green zone, which is under 3%, he was able to, begin to encourage people to come back to Hawaii. All of this has a positive impact on our healthcare system, but also has challenges associated with it, like people's mental health, our economy, just our general wellness as a people. So these are the things that were being considered. And I, like many of you out there, we're glad to see us begin to move toward normalcy. Not to normalcy just yet, but we're moving in the right direction.
And so at this point in time, for those who may be watching outside of the state, do you echo what the governor is saying in terms of welcoming visitors in resuming maybe some of these larger events that are planned for later this year? What can you tell us about, just the overall, as you say, return to somewhat normalcy, the return of guests and visitors to the islands, and the return to normalcy with regards to what they present and options for conferences and events that would bring them here?
I do. Back about 3 weeks ago, when we got to a place where we were under 50% of our peaks, meaning our hospitals had enough capacity and under 50% of the peak cases that were active, I knew that we were able to begin the process. And a lot goes behind the scenes to make these kind of recommendations. We're safe to open up again. So we never had cases from travelers that exceeded about 2% of our total cases. Although there's, of course, spread when people are working and with one another at the workplace or in schools, that does happen. We also have to survive. So that recommendation was necessary in order to 3 or 4 weeks from now be ready to actually get those travelers to come back during the Thanksgiving holiday and eventually Christmas holiday. This is what a lot of our economic survival is based on, and we're able to contain the cases because look, we have a ton of immunity now. What's gone on in the last 3 months is the following. We've now gotten well over 70% of our whole state fully vaccinated, so we can do it safely. We're at 93.4% of all of the people who are eligible to get vaccines, 12 and older, have at least started their shots. In about 9 days, we're going to see kids start getting shots from ages 5 to 11, like my son Sam. And that means when travelers come, we don't have to worry about spread. We should still be smart, but I will say this. We should open up widely for outdoor recreation. I don't think there should be any restrictions whatsoever after November 1st for outdoor activities. People should still be smart, wear a mask if you're unvaccinated and you're around others, but outdoors is a safe place to be. And that's where you see almost no spread. And as travelers come back, it's a very good thing for Hawaii. We want people at the beaches. We want people enjoying themselves. We're okay to do that. And so a lot of us were putting some pressure on the governor to make that decision because we had good, safe health indicators.
So are you saying that there should be no limits on outdoor gathering sizes? So that means an outdoor wedding, baby luau, or even the marathon, let's say. What are you thinking in terms of those large scale events? Obviously, there's a big spread between a birthday party and the marathon, but what's your thinking when you say that there should not be restrictions on outdoor events?
If people are vaccinated, there should be no restrictions. In other words, if you have a really big event that you want to have and people are all vaccinated and you can confirm that, it's really not a risk. We're going to have to live with COVID because the word is endemic. That virus will be in all societies in every corner of the world. But if you're vaccinated, you will either not catch COVID at all, or you won't get sick if you do. And so we have to move forward. So when conventions are ready to go again, when travel for big gatherings like the marathon or the Ironman, which I can't wait for that to come back to Hawaii, this is all safe when it's outdoors. In fact, we want to be encouraging these kind of outdoors vaccinated events because that prevents people from staying indoors and having indoor events where it's higher risk. So I really am a firm believer that we should have no restrictions whatsoever on outdoor events as long as people are vaccinated.
One of the reasons why the restrictions were put into place, and as you mentioned earlier, was this toll that it was placing on our hospital. Ingrid Peterson has a question related to that. Are we still using the 650 plus nurses and other critical care specialists? We know that that was a big factor in allowing some, providing some support, I should say, to our hospitals. What is the status of those who have come in to help our medical industry during this time?
Oh, thank you for the question, Ingrid. We are using them still. They're beginning to end their 2-month contracts in kind of the same rolling fashion that they came in. We rolled them in staggered numbers to make sure that we had them covering our hospitals. And now some of them are leaving. Some are staying actually on contract, and we may actually recruit some of these individuals who are terrific healthcare providers to be allies to our homegrown providers here in our hospitals. So some will stay on their own contracts at Queens and HPH and Castle and so on. So we'll have some of them stay. We're probably another 3 weeks out before all of those 8-week contracts are done. But it really served its purpose. So special thanks to Hilton Rathel and his team and the Department of Health for making that happen, because it came exactly at the right time when we faced the surge.
There's a bunch of questions today here about post and pre-travel testing. Amy sort of sums up what a lot of people are saying here. Virus is already here via travel. Pre and post-travel testing is needed to be implemented once travel open. What will the state do should the numbers jump high? Are you anticipating any changes to the Safe Travels program, especially with the surge of holiday visitors that we can expect?
The changes first that we're working on are to make sure that we're in sync with the federal changes, as the federal government has made some rules for international travel based on our program, I believe, which is based on vaccinations and having a pre-travel test. We've had that program now for more than 12 months. It meant that we had over 7.5 million travelers. 1.2 million of them were us going and visiting our families on the mainland and coming back. And we had very few cases. It was 1% to 2% of all of the virus cases were from that group. The other 98 to 99% were from community spread events here in the state. I do think we should always be open to having more testing. We're doing a lot of testing in the background now, but going in, making wholesale changes to Safe Travels now that we are well over 70% fully vaccinated and over 90% initiated for all adults would be probably more than anyone would ask. And the reason I say that is, remember, no other state is doing any of this at all. Yet we have been safer, kept our numbers down, and we have the vaccine requirement. You don't have that requirement if you're driving from California over to Vegas. You just don't. So we're still being more careful. but we're being smart about it, because if you put too many restrictions, no one will come. There will be widespread hunger. There'll be more poverty. There'll be more homelessness. And so we're just trying to balance those things. I understand people's concerns, but we're in a much safer place than we were at any other time during the pandemic because so many people are vaccinated.
We're already beginning to see some of the restrictions that were set into place by the governor to begin to be lifted or modified in some degree, with gathering sizes and what people are allowed to do and how they're allowed to gather in terms of the numbers. How long do you think that we will continue to see some of these restrictions in place? Do you see further lifting and some flexibility there? And when do you think that might be coming?
Well, the mayor's put forward some very thoughtful recommendations to the governor. Some would, if the gov accepts them, be implemented in early November, I believe around November 3rd. And then if things continue to go well, 3 weeks later, where if the numbers continue to drop by 50% each cycle, we could see a really significant lifting of all restrictions on or around Thanksgiving time. So I think that's right now the most likely scenario. Again, if you're vaccinated, you're safe from getting severely ill. If you're vaccinated, your business should be open. If you're outdoors and having an event, we don't have much risk at all. So there's other things that have to be addressed. For instance, restaurants right now. I was in a restaurant last night and they're really struggling. They're struggling to survive and employ those people, but they haven't had any spread in their restaurant at all. We probably should move towards 75% capacity as soon as we can, because people, once again, are vaccinated and they're just not likely to make any dent in the numbers. So these are the kind of things you'll see in the next couple of weeks. Again, outdoor restrictions are not particularly useful anymore at all when you're this well vaccinated. Indoor restrictions, gradually reduce them.
What's your thought on Safe Access Oahu? Do you think that's a program that should stay in place? Do you think it's been successful? And is it something, I know there had been some talk at one point of perhaps creating a statewide program so that all the counties would basically have the same laws, because right now the restrictions on Big Island and Kauai are not the same as those on Maui and Oahu. So what are your thoughts on Safe Access Oahu, and should we adopt something like that statewide, or is that something that you would support getting rid of?
Well, it's always better if the rules are the same all the way across the state, so we don't have so much confusion. So from that perspective, I do want them to be statewide. But I do think eventually these rules should sunset. Just to be fair to people, we've given people a lot of time to go get vaccinated, to be smart, to be safe. And most people, over 90% of the people that can, have stepped up and done that. Other people do have philosophical oppositions or religious oppositions to getting vaccinated. We also want to respect that. They're putting themselves at risk, unfortunately, but they're not really putting many other people at risk now that we're so well vaccinated. Eventually, those things could go away, because that was one of the concerns that many people brought up. Didn't totally agree with them. They thought that we were going to be some kind of state that was constantly checking on you and being like a nanny state. That's not the goal. The goal was just to keep people from dying from COVID. But once we see the bottom drop out from the virus, in other words, that there's so little virus in the state that we don't really have worries, and people are traveling here vaccinated, we should probably get rid of, at that point, the Safe Oahu Travels program, because I think we heard a commitment to not have a perpetual vaccine pass. We really have come through this well, but we want to move on from COVID eventually. And the way to do that is to be vaccinated and then get boosters.
In this next phase of the vaccine rollout, we're looking at potentially two separate things here. Of course, one is children being this next group of individuals that will be eligible. And then we also are having that conversation about boosters, focusing on children first. When we're looking at the availability for vaccines for children and the current restrictions as it stands right now, with only vaccinated individuals being allowed in, do you think there might be some modifications made to allow parents who maybe do not feel comfortable giving their children the vaccine, but maybe taking a testing and allowing a testing option for children to be allowed into some of these venues that currently do not allow it and only allow fully vaccinated individuals?
It's a good question, a tough one. It's really up to the mayor. The mayors have to make that decision as to how they want to address kids that are under 12. I will say this, about 60%, maybe a little more, of children between age 5 and 11 will likely get vaccinated. That's just when I reflect on how many adolescents got vaccinated. It's probably how many of our 5 to 11-year-olds will get vaccinated. Again, people are going to make up their minds as individual families, and I'm just going to respect them. But it might be that they have to wait until all of these restrictions are lifted before things get back to normal. And I think that that's okay. People are making decisions and they're factoring that in. Overall, though, the mayors have to be given that prerogative because they know their population just a little bit better. They're a little closer to the ground than the Gov or I are on most days. So, and given most circumstances. So I'm encouraging people to make a smart decision for themselves and their family without demagoguing the issue.
On that same point, Rains, I got a question here. Sorry, let me call that up. Will adolescent COVID-19 vaccinations for the 5 to 11-year-olds be mandated for children to attend in-person learning? Do you think that that will become part of the vaccine requirements? We already know, those of us who have children who attend school, there are a series of vaccinations that are required. Will COVID be, you think, eventually just added to that list?
Well, that's not been my recommendation. I think that because this is a new vaccination and a new virus, there would be widespread concern and pushback if that were to happen. Now, having said that, I'm absolutely in support of vaccinating children, and I'm doing it for my own children, but I'm trying to help heal society, and I don't want to see that rift. What the governor and the Department of Health and Department of Education recommend, that will be up to them. They have the current authority to do that. But overall, we've done such a good job controlling cases. We have not seen significant outbreaks that have meant hospitalizations for kids. We're doing well with the circumstance that we have right now, which is not having a mandate. So I think it's okay as is, and I think it's given people enough space to make decisions for their families. I would like to give a little bit more opportunity for people to do distance learning if they still have a worry, or if they've got a child that simply can't get vaccinated. They've maybe got an immune system problem. So we really have seen Hawaii do better than anyone else to come together, and I'd hate to see something suddenly disrupt that harmony. When we move out of the COVID crisis, there is a little bit of healing to do because it was very scary for people. This was certainly a traumatic event, which means you've got lots of extra people with depression, with anxiety, and then of course there are the people that just simply just don't quite believe what I do on vaccinations. And these are very tough decisions. Over time, most people will want to get vaccinated or have their children vaccinated against COVID because just like a lot of other infectious diseases, it can really cause a lot of harm to our loved ones.
What can you tell us about the booster rollout right now with those who are eligible? How many people in the state are taking up that offer to get boosters? And are we seeing enough of those individuals who need to get it, especially our kupuna? Are they getting access to it, and are they going out and getting these booster shots?
They are. It's accelerating already. We're at now 62,570 individuals who have already received their third shots. And we haven't even had the full authorization of Moderna or Johnson & Johnson, which I believe come next week. So that's going to skyrocket. I would expect that we'll be talking a lot about boosters in the coming months. As the cases drop, as the restrictions go away, and we get back to normal in that space, it'll be boosters and then outbreaks in under-vaccinated parts of the state that will probably be most interesting and impactful. But absolutely, boosters are surging. And I think people are waiting for a couple answers. Number one, the only booster that's currently fully approved and recommended is the Pfizer booster. So if you had Pfizer twice and it's been 6 months and you're in those categories like you're older or chronically ill or a high-risk profession, you can go get your booster. Soon you're going to also have it for Moderna and for Johnson & Johnson. And they're going to do what's called, and this is a tricky word, heterologous vaccinations. And what does that mean? That means crossover vaccinations. So if you got the Johnson & Johnson, there will be a recommendation that you can also either get that one, which we are trying to stick to. Please take the same one if you can. But otherwise, you will have this option. You could go get a Moderna shot on top of it. And that's been very effective.
George White has a follow-up question. He says, how are we tracking immunity for our community given the waning immunity factor that is ever present? We know right now that the boosters are limited to kupuna, but can the rest of us anticipate being able to have access to the boosters at some point? And, what are the thoughts right now on waning immunity?
The thoughts are that it does wane. You do lose immunity after 6 months. Usually it begins to drop off. You still have a ton of protection, and your system would be able to respond to an insult from the virus. So you should still be protected from severe illness, but you'll probably be a little bit more likely to catch the virus because it's still out there. Though less virus is out there every day because it's been falling off. We expect that just like we did before, we'll first start with boosters for 65 plus, our kupuna, our highest risk individuals in certain jobs like nursing and medics and so on, and people who have underlying health problems like diabetes, heart disease, cancer, and so on. Then 2 to 3 months later, it'll get opened up wide to everybody. There will be enough vaccination to do boosters for everyone. And again, if you've been 6 months out, the recommendation will be to get your booster from Pfizer or Moderna for that group. And your second shot for Johnson & Johnson is when it's been at least 2 months. So that's the protocol that's likely to happen. And I'm going to encourage everybody to go get a booster. It's just a reminder to your immune system that you have this capacity to fight the virus.
How long do you foresee us using the vaccine as a verification point for establishments, for travel? When you look at it, vaccine verifications has been incorporated into so much a part of our lives now in so many different ways, in ways that we meet others and in ways that we go to restaurants. How long do you think that will continue to be a factor? And a second follow-up question to that is, do you believe that the booster shot will then also be required? Because at some point in time, say a year from now, if we're still using vaccines as a verification point and someone has not gotten the booster, you have to imagine that immunity will be somewhat low and that they would have needed the booster. And will that be a determining factor added on to that overall verification process?
Well, if it is, the answer will be that you are fully immune, meaning that you stayed up on your shots. Because, for example, if you got your second shot 6 months ago, you would now be due for the booster and you'd boost your immunity and you'd be back up to date. Some people, about the 7% of our society, may just start their vaccinations in the next 2 months, and they wouldn't be due for their booster, of course, until they got the first 2 shots and then 6 months later. And that will be another part of the population. We're going to be getting vaccinations against coronavirus in 22, 23, 24, very likely. And most people will want to get them because it's going to keep that immunity up. Then it's going to fall off the map, and I don't think it will be as big a deal. We certainly should not anticipate always having to show a vaccine card. I think that when society is very well vaccinated, we won't be focused on COVID like we used to be. For instance, right now, we don't show vaccination cards for other illnesses. We don't have a measles problem in Hawaii or in America. We don't have a mumps problem. We don't have a chickenpox problem of any consequence. So obviously, with no big outbreak, we're not carrying around our yellow cards to demonstrate that we're immune. We'll eventually get to that same space with COVID where we're not as worried because so many people are protected and there will be so few cases. I expect we're not going to be talking about cases day to day in 2022. Occasionally we'll do an update, maybe a weekly or monthly update, or we'll hear stories of outbreaks, but we won't have it kind of in our constant forethought. So I don't know when they're going to recommend some of these vaccine cards to be kind of backed off from. Probably toward the end of the year would be my best guess.
Toward the end of this year?
Toward the end of this year, it makes sense that we're certainly going to use vaccination cards for travel. I think the governor, because he's pretty conservative, will want people to show vaccination proof coming back. But when we're well over 90% vaccinated or immune, it won't be as consequential. So I don't think that we're going to be as focused on these kind of cards or passes for restaurants. I could be wrong in my thinking about how the mayors and the governor will respond. But moving to normal when there's not much COVID around will be kind of, I guess, the priority. And as long as we're not seeing hospitals fill up with patients, as long as we know that there is widespread immunity in society, COVID will be more like people getting the pneumonia vaccination. It'll be more like people getting their measles, mumps, and rubella vaccinations. It'll be more like those vaccinations. And that's what's happened with viruses all across time. So I don't know why that wouldn't happen now. I will be watching, though, week to week and day to day for what's going on around the world, because we get travelers from all around the world. And if there are other variants that start coming up, we'll be careful. We now have a good idea on how to deal with this from a public health standpoint. So we should be nimble if there's suddenly a new threat, but I don't think we should let it dominate our lives in the coming years.
Piggybacking on that real quick, Marianne wants to know, how long will we have to wear a mask? If we're getting to a level that you're talking about, can we then start to lose masks as well?
Well, we're losing them already outdoors, right? So right now you don't really need to wear masks outdoors for the most part. Indoors, once we reach, critical mass on protection, in other words, widespread immunity, eventually people will bite the bullet and say, if your office is fully vaccinated, you don't need to wear a mask. That's where we will be when we've gotten down to so few cases, like low double-digit cases again, where there's almost no spread. Eventually people will know they are safe. I got vaccinated. My colleague has been vaccinated. We don't have many cases in Hawaii. It's just not going to make sense to wear masks all the time indoors. But We're a little bit away from that right now, and we're trying to be very careful because we got traumatized by the surge from the Delta variant. We thought it was over, essentially. When we were at 2/3 of our state vaccinated, people started feeling, oh, we're pretty safe. They were safe because they were vaccinated. And then we realized how infectious that Delta variant was. So we'll keep focusing on that. The good news, though, is if you're vaccinated, I'll say it for the 10th time, you're not going to get so sick that you end up in the hospital or that you die. Very, very few cases have resulted from that. And usually that's a situation like, well, let me say something to honor Colin Powell, an incredible human being. None of us are perfect, but he was amazing in his service to America. And he was 83 years old, vaccinated, but he died of COVID. Why? Because he had immune compromise. He had multiple myeloma, which is a disease that compromises your bone marrow and your immune system. And so General Powell still caught COVID and died because he couldn't get an immune response. But that's only 3% of the US population that lives in a circumstance where their immune system is compromised to that degree. Everyone else is able to fight it off or get an immune response from a vaccine. So, you know, that was a tragedy, but on the flip side, it's rare.
With the governor's announcement yesterday welcoming visitors back to the islands, there are many in the hospitality industry that are hoping for what they call a holiday surge. Are you at all concerned about the response by the local community, seeing as what we saw with the summer surge, with the amount of visitors coming and the at times confrontational moments between local residents and visitors and trying to find this balance? How concerned are you about that? And what do you think the state can do to help to ease some of the tensions by local residents as well as inform visitors that are arriving?
Well, one of the ways to ease the tensions has been the Safe Travels program, because we're asking all travelers to make a commitment, and it's an ongoing commitment to either be vaccinated or pre-tested. So visitors who come here, they have no choice. They have to do that, which means they have to really travel with aloha. And so that should mitigate that problem. That was one of the ideas that I had back last October. That was one of the reasons we pushed this idea as a team, because I knew that that kind of conflict could arise. Everyone has to understand that we're in a global community, and we want to have a more sensible and smart tourism industry. We want to have fewer travelers overall that are committed to the Hawaii experience, because we saw how bad it got when it was 11 or 12 million people coming to the state, our small state. On the other hand, we also are an aloha state. We're loving to all travelers, and so we really can't have those kind of conflicts. I think they welcome us when we travel to the mainland or to Europe, wherever that may be, to Asia, and we should welcome them. But I do think there are going to be some changes to our tourism industry in the coming years, because what we saw was our carrying capacity could not sustain that many travelers, and infectious disease was one part of that inability to sustain what we were doing. Just too many people too close together. So we'll make adjustments. I'll do my part. If I'm continuing in a leadership role, I will definitely focus on that, because this is a very dynamic planet we have now, and everybody still wants to come to Hawaii. Let's just be honest about that.
We're almost out of time, but I want to ask you before you go when we can expect you to announce for governor. I took a sneak peek at your website just a few minutes ago, and I see merch there. I see lawn signs, mugs, t-shirts. So obviously you can shop with your campaign. When are you going to actually announce that you are running for governor?
Well, thank you for asking. Right now, to be frank, I'm very focused morning, noon, and night on finishing COVID off. Still more worried about people in the ICU than I am worried about myself possibly becoming governor in the future. But Jamie and I will make an announcement quite soon when we think it's very appropriate. Right now, let's just finish COVID off, and then we can move to the politics of the future.
All right. And if you want to break that news when you're ready on this show, the next time you're on, by all means, you're welcome to do that as well. we always enjoy having you on. Lieutenant Governor Josh Green, thanks so much for joining us here this morning.
Thanks for having me.
Thank you.
Aloha. Well, great to hear from him. And you heard a lot of optimism there. He was saying even as close to as the end of this year, we could lose some of the requirements for having to verify vaccinations. He's calling for basically no limits on outdoor gathering sizes. That includes anything from luau's all the way to the marathon, as long as everyone is vaccinated. He's really pushing for a robust tourism, a holiday surge, if you will, saying that we need to roll out that welcome mat, and that just like folks welcome us on the mainland, we need to welcome them here. So you really hear him pushing for things to return to whatever normal is these days.
And he also mentioned some of the recommendations that the mayor has submitted to the governor about easing some of those restrictions, which could come as early November, in just a few weeks. We'll see if the governor makes a move on some of these changes that the mayor is recommending here for the city and county of Honolulu. You also heard him talk more about some of the booster efforts that are being made and how they will be really working hard to ensure that people have the ability to get booster shots, focusing in, of course, on the kapuna and the elderly population before moving on to those who may want to receive their boosters in part of the general population. But again, his optimism also extends to seeing those numbers with kids being available to get the vaccine as well, helping to also help the overall immunity level here in the state.
Yeah, his estimation is that about half of the children who are eligible, ages 5 to 11, will get the vaccine. He says that's based on sort of the uptake of teenagers so far and families there. So that will obviously contribute greatly. But he held off on wanting to require that for schools for in-person learning. And he said that distance learning should also be an option for families who still want that. So always great to hear from the lieutenant governor. And, you know, the merch is up, but he's not quite ready to announce. We know, though, Ryan, that is coming.
I mean, you know, it's not going to be a surprise to anyone whenever he decides he's ready to announce that he is running for governor. But I guess if people wanted to get signs, they can. We just haven't heard an official statement by him just yet. So to be determined on when that exact date is.
On Friday, we have Dr. Libby Char joining us. We want to talk to her in depth about the vaccine rollout for kids, what that's going to look like. The governor had mentioned when he was on that they want to use the network of pediatricians, and we do know that there will also be some opportunities at the schools themselves. So we'll dive deeper into that with her and also get her perspective. Does she think it's time to lift outdoor gathering sizes, and what's her view on masks indoors and outdoors? We'll ask all of that to Dr. Libby Char right here at 10:30 on Friday.
We'll see you then. Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.